This is, a really important mistake that we've again made in medicine. And, if there's physicians and scientists and nurses listening to this, first of all, I want to just thank you for your effort. I know how exhausting it is to be in a hospital when there's a crisis at hand, especially when you feel poorly equipped for it and you feel like you can't help the patients that are coming to you who are suffering and dying, and you don't feel like you have the right tools. And so my hats are off to all of you who've been on the front line. It is exhausting. It is overwhelming emotionally. It is overwhelming physically. And you feel like, especially when there's a story of some deadly virus, you feel like you're putting yourself in harm's way and your family's in harm's way by being in those hospitals. So hats off to all of you who have been on those front lines. But what we saw, is going to take us, months and maybe years for us to really, seep into, because it's a devastating story that we created in Western medicine here, is that we reached 88% mortality rates in New York City, in the most, medically advanced society, apparently on earth. We created the highest mortality of any virus ever seen. Ebola has a mortality around 30%, and we hit 88% in our ICUs. Nowhere else in the world did we see that kind of mortality happen. And so why are people dying if Zack is right that this is just like some benign genetic update that we're supposed to get? Like, why are these people dying? If there's not enough genetic information in that virus to cause death, then what's causing the death? And so that took some research when this started happening. I was trying to figure out why this coronavirus, and what I found was that 2002 mimicked the exact same thing. And so SARS, it turns out, caused blue patients, hypoxic patients, that a few days later their lungs would fill with fluid, and then they would die of multi-organ failure in the weeks to come. And so that's exactly what was happening with these patients here in New York. And I didn't get that story until there was a nice Instagram post from one of the New York docs on the front lines, and he put together a beautiful story saying, we're got something wrong here. These aren't infections. These people are showing up hypoxic at levels they've never seen before and talking to me. They're not infected. They're not like acting septic, but they're hypoxic from the moment one. And then they get worse and worse over the days that follow. And respirators don't work. They seem to make it worse. You put them on a ventilator, they tank. And so he was just a call to act, for help. And so when I heard that they were turning blue, then we knew that, okay, they're showing up the same way SARS did, which was another coronavirus, and very similar to the current one. Then you look at 2012, MERS out of the Middle East, same pattern. And so we now can say, okay, there's a pattern that developed somewhere around, the 2000s, where coronaviruses, which has been with us since, 740 years ago, there was a very well documented coronavirus, situation. 1200 years ago, there's a suspected coronavirus situation. So, we've got a pattern of this virus for hundreds and hundreds of years. And then suddenly there's a change in its behavior, or our behavior around that virus in the late 90s or early 2000s. Excuse me. And what happened during that time was a ubiquitous introduction of a chemical into our food system through genetically modified crops, which was called glyphosate or Roundup. And that compound happens to block the production of some very specific amino acid building blocks for specific proteins. And one of the proteins that is very reliant on these essential amino acids that are disrupted by glyphosate happens to be a gene that builds our relationship to viruses. It's a gene that produces an enzyme that, like scissors, cuts up the DNA of viral genomics when they come into the cell, so that we don't overexpress this DNA. And so around the advent of glyphosate and Roundup, we see this event of an abnormal relationship built to this. I'm going to slide out of the sun while we're talking. And so an abnormal relationship is built to these as we lose the enzyme control mechanisms by which we stay in a balance with these. And so through chemicalization of our food system, we disrupt the homeostasis of this virus in our genome. And then around that same time, we see the explosion of air pollution in China in particular, other cities around the world for sure. But China became our most toxic air polluted space in the world in the late 90s and leading up into the new century. And so by the time we're looking at 2006 and all that, you are getting pictures of Beijing where you can't even see the skyscrapers. It's just like buried in pollution. And it turns out that around that time, we were able to show that coronavirus and influenza bind to a carbon particulate in air pollution. It's called PM 2.5. Particulate matter 2.5 microns is a measurement of this tiny carbon particulate that can bind many things in the atmosphere, including things like cyanide. And so when you have viruses that are being produced and go aerosolized, as they should, they will bind and clump on PM 2.5. So now you don't have even distribution of genetic information. You have clumping of genetic information that's now tagged to go to the lung through the ACE2 receptor. And now you've got a delivery system for cyanide that's tagging that same PM 2.5. And it turns out that cyanide poisoning presents with hypoxia, blue patients, who a few days later will present with multi-organ failure and disseminated intravascular coagulation or blood clotting in tiny vessels, and they'll die of multi-organ failure. Cyanide poisoning has been a long-standing, story of how people would kill each other in the dark ages and everything else. We've known cyanide causes this thing that we call histotoxic hypoxia for hundreds of years. And so it turns out that as soon as that New York doctor, described what he was seeing, it was like, oh, that's histotoxic hypoxia that they're seeing. And then, I gave a few podcasts on that, trying to get the information out there so that people would start treating cyanide poisoning. Because that's actually super easy to treat and almost free to treat. It costs like $10 for a cyanide poisoning packet. It's sodium nitrate and 2 other injections. You give those, and 3 minutes later, the patient should be reversing their cyanide poisoning. And so instead of a 3-month hospital stay, racking up millions of dollars of bills for these patients that are surviving COVID, a $10 package of cyanide kit should be able to reverse this whole process, because you change the shape of the hemoglobin that's been poisoned by the cyanide. Now, is it really cyanide? It could actually be a dozen at least other chemicals that are carried in high concentrations of air pollution. And so the virus is intended to enter the body through the ACE2 receptor into the bloodstream, but now it's tagged with all these kind of Trojan horse chemicals that we've produced in our energy and transportation sectors into the air. As we see PM 2.5 drop in China, as soon as everybody was pulled out of the streets, suddenly everybody stopped dying from coronavirus. It was like somebody threw a switch as soon as PM 2.5 went below 40 parts per cubic meter. And so it's very profound that it was not social distancing, it was not masks, it was the drop in air pollution that best matches this. The article out of Harvard that mapped air pollution quality in the areas of high mortality showed that for every 1 particle per cubic meter of PM 2.5, for every increase in that level by 1 microgram increase, there was a 10 to 15x risk of death. And so 1 extra particle, per this, cubic meter, and you have mortality increase. And so it would be impossible to find any other risk factor greater than that. And if we look across Europe, the most heavy PM 2.5 in the country is Northern Italy. Pockets in Germany, pockets in the UK, exactly where we saw it. Highest in the US, New York City, Louisiana, 4 corners of Colorado, out into parts of the Northwest. And so all the pockets of the highest mortality around the Western civilization occurred in these areas. Hubei province, highest concentrations of glyphosate and Roundup in the soils that would have disrupted our relationship to the genomics scissors no longer working, and the highest particulate matter of PM 2.5 in the world. And so Hubei province was where this thing had to begin, really, because we had created the environmental stress that would encourage the virus to occur in the first place. The virus, again, is an adaptation signal to the world saying, there is crisis, there is toxicity, there is need for change to happen genetically. Here's the genetic update. And then it gets tagged to PM 2.5 and can now travel the whole world attached to carbon particulate matter in abnormal clumps. And so we were set up with this kind of chemical toxicity that's now circulating around the planet to poison pockets that were predisposed. And those patients that died were cardiovascular patients, end-stage kidney patients, and diabetics. It took me a couple weeks to figure out why those 3, because it should have been lung patients, right? It should have been COPD, emphysema, all of our typical risk factors for flu. In fact, it's a very simple solution in that those 3 conditions happen to have one unifying factor, which is they get put on the same 2 drugs. They all get put on a statin drug and an ACE inhibitor blood pressure medication. Diabetics, cardiovascular and kidney disease. Those two drugs upregulate the ACE2 receptor in the lung for this virus. And so through the pharmaceuticalization of our elderly, we create this incredible receptor device for abnormal toxic clumps of coronavirus, and then we vilify the virus for these patients dying not from infection, but from histotoxic hypoxia. 5,700 patients admitted to the hospitals in New York City were published in JAMA, and those 5,700 patients had no fever. Their average temperature was normal. Their average white blood cell count and their lymphocyte counts, normal, no signs of infection. And yet they were showing up blue, hypoxic, and with early organ failure, and days later would develop fluid in the lungs and secondary pneumonias in the hospitals, and then they would get the disseminated intravascular coagulation. They presented and died from histotoxic hypoxia that never got treated. And so there's a tragedy to the medical mind here in that we were told so much about this scary virus that it didn't let us think about the simple reality that was right in front of us, is these patients aren't presenting sick, they're presenting poisoned. And we just couldn't put those pieces together fast enough because we kept believing in this virus story.